Hey, we're back, everyone. This is the Ben and Gary show, and we of course have Dr. Pinto with us. We're really glad to be back, and it's been a long time since we've been doing this. It's been too long.
It's been 3 months at least. Right?
At least 3 months. You can tell we look a little different right now. No more shirts, no more ties, or collar shirts and ties. And but we're really happy to be able to talk to you and want to let you know a little bit about what we've been doing in our time off. Like before we kind of get into maybe like what we do as a patient coming in and the changes that we've made. What have you been up to, Dan, in the process once we've been off?
Well, I think I've been appreciating the sun for sure as things warmed up.
Exactly.
Plenty of time to enjoy outside.
I think we've all been doing that. Gary, how about you?
Well, I'll tell you what, I've just thinking about the patients that we haven't been able to see, and we miss you guys, and glad to be back. Glad that we're able to work out of all 3 offices at this point, and it's just been great to see everyone coming in with smiles, and they're happy to come in and have their teeth cleaned.
Yeah, I think that's a good, wise point. I think in our time off, we realized that, everything seemingly has to change because of the pandemic. And we've been working really hard to be able to create a flow that is going through our office that's going to keep you safe and still keep to the same standards that you always have seen that we've kept. So perhaps maybe we can kind of run through a little bit of like how you should expect when you come back to the office, and that starts off with some screening, and that screening is going to happen twice. First time before you even get into the office is screening over the phone when your appointment is scheduled, and then as you arrive at the office, you will notice that our front door is wide open so that you don't have to touch anything, and that there are going to be some barriers that are present when you get in. They're going to have the sneeze guards. Gary, thanks for getting that taken care of.
Well,
And Dan, I believe you had something to do with just kind of how the table in the reception area was set up. So, so once you get past that or get to that point, we have a few things here such as your touchless temperature check and blood pressure, as well as also your oxygen saturation in your blood through a pulse oximeter. And perhaps Dan, you had a situation that came up where an individual was kind of surprised that their oxygen level was low.
Yeah, so something that goes right along with coronavirus is what's called silent hypoxia, which means that typically you want your oxygen level to be above 95. I mean, even someone with COPD, even someone with problems, their blood oxygen is pretty high. It's not something like sugar where it fluctuates. Your brain needs oxygen all the time. So your blood's always having the same level of oxygen, your body causes that to happen. So with coronavirus, for whatever reason, the blood clot, these microclots that can occur in the lungs can actually cause your blood oxygen to drop, but you don't feel it. So normally when your blood oxygen drops, you feel it like you're going to high altitude or other reasons, or even wearing an N95, right? There's less oxygen coming in.
That's for sure.
So you feel the lower oxygen, whereas with this, the silent hypoxia, you don't really feel it. So you could drop below 90 and not even feel it. And then at some point down the road, you'll just all of a sudden crash. And that's when you're gonna look into going to the hospital. So to preemptively get to that point, we wanna make sure the person sees their physician if their blood oxygen is below 90. And it's also suggestive that you may have coronavirus or been exposed to it as well.
Sure.
So
it's all about safety, correct?
Right, so it's just kind of one of the markers. Not everybody's going to have that, but just one of the markers that we can use as a tool to kind of screen people and make sure that we catch things before things get worse.
Sure. So if you pass that test with temperature, pulse ox, blood pressure, screening questions about travel and who you may have been exposed to, what can a patient now expect at the next step here? Maybe Gary, I know you have a little experience with that as well.
They'll be coming back. We have a one-way direction, so this is a big loop in our office here at M Street. So you'll enter the one area on the one side, and then you'll travel around to the treatment area. So then of course, our assistants will do another little bit of screening. They will have you rinse with the hydrogen peroxide rinse for a minute, and then they'll set up the rooms, and of course they'll open all the instruments from the sterile bags in front of you, so that you know that everything's been sterilized.
Yeah,
And,
yeah.
Then we'll come in. We, of course, we have our own garb that we wear. So
Quite a bit of
we've got our gowns,
layers.
of course, our N95s. We have face shields.
Yeah, if you check out our Instagram page, it'll show us all gowned
Yeah,
up with the
and,
face
exactly.
shield and everything.
Have a little fun with the boomerang.
Yeah.
That was kind of silly. That's good to do. Well, let me just get back to another point that I found for patients. It's very common for patients to walk around with their gloves on and a mask, and we appreciate that. We understand everyone wants to be able to stay safe. And if that makes you feel safe, terrific. Go ahead and keep doing that. However, when you arrive at our office, definitely have your mask. In fact, you're probably not even able to get in the building without your mask on. However, beyond that, once you get to the office, if you have on gloves, if you're coming in, we ask for you to remove your gloves and use hand sanitizer. And so, because your gloves can really give you a false sense of security, and people usually feel very comfortable touching anything and everything. And if that's the case, you're going to bring those in and cross-contaminate pretty much anything in the office. So that's why we ask you to remove your gloves once you get here. Now, if you throw them away or you don't have an extra set, we can certainly let you have a pair before you leave, so you can feel safe as you walk out. And I guess after you've passed all those tests, that's when you can finally remove your mask and actually be treated. And so you'll see us under several layers and coverings, and then you also should probably realize that the office is going to need to be a little cooler, because there is no way we can survive under all of that without perspiring. And so we need it a little bit cooler. So if you need to have something that's going to keep you a little warmer, please bring it with you. We used to give you blankets, but we can no longer do that at this point in time.
Right.
So dress appropriately. And after that, it's pretty much getting treated as you normally would. We always have sterilized everything. We've always autoclaved everything. We're actually hand washing even more so these days. So and after that, I guess you just expect that treatment should commence as it always has. And then as you leave out, Gary, you mentioned there's a flow.
Right.
That's going to be going in one direction,
Right.
back to the front desk. We have that sectioned off and cordoned off so that you're not mingling with other patients. And if there is a sort of a bit of a log jam, we usually ask patients to separate. As you can tell, office area here is kind of set up so that we just don't have as many seats as available. And we know that you guys know about the 6 feet rule at least,
Right.
but this just sort of gives you a sense of like what that's like. So. After you leave, we kind of have another sort of process, because we're also, in addition to in the day, we're wiping all kinds of high touch areas down with our Cava wipes, and those will be things that we use that completely sterilize well beyond the coronavirus to hepatitis B, tuberculosis, which are much more difficult to kill and to keep you safe from, because they live on surfaces for literally weeks. So, and corona can be killed, very easily. And just in case we have, sort of an additional layer to handle some areas where it's kind of hard to get to. And I know that Gary loves being able to use our fogger.
Right.
Yeah.
So we use the hypochlorous
Acid, yeah.
and this, of course, forms a fog or mist, and so that kills any coronavirus that may be airborne.
Or on other hard to reach surfaces, because it does linger
Right.
and get on other surfaces. So
that's been very effective.
it has been really effective, and so consequently, that the 3 offices all have the same kind of protocol. And we're located right here on M Street, where we are today, and we're also in McLean, Virginia, as you may have also been aware. And then our 3rd location is on Pennsylvania Avenue. And I have to say that phones are ringing off the hook to get in the office, and that's because patients have really felt safe, and they've said a lot of good things about us, and we've been getting terrific feedback, and we always want your feedback. This is just one way for you to be able to do it. This is the Ben and Gary Show along with Dan Pinto. You guys have anything else?
The air
Oh, I'm
filters.
sorry. How could I forget the air
We're moving
purifiers?
right along here.
Yeah, exactly. So those are like N95. They're down to that same micron level.
Right, the 0.3 microns, and we have them all spread out the office, and that has UV light actually inside. So when
Right.
it brings the air in, it shoots the UV light through the air
Yeah.
as it's passing through the filter.
I believe it actually also analyzes the air quality and it titrates its
Right, so it's not always using it.
It's not always
when
using
it's
it at the
necessary.
highest level, only when it's necessary. So
Right.
we've kind of got like smart filters at this point in time, and that's really cool. So I'm really impressed with what job that you guys have done, that we've done, our whole team has done to be able to work so hard to be able to keep you safe and let you know that we're still here. We haven't gone anywhere. We just kind of shut things down for a little while to make sure that we were past sort of this time where we weren't as prepared for this pandemic. I feel like we're prepared. Our feedback, check us out on Google reviews to be able to see what kinds of things that patients have been saying about us. And if you have any kind of comments in there, please feel free to do so.
All right.
All right, guys, we'll see you next time.
Bye.
Take care.